laparoscopy surgery is also called surgery, and this is where you're performing procedure to assess the inside of the abdomen or tummy, and using tiny incisions on the abdomen, but also using special equipment which are designed to be able to go through those small incisions to perform the procedure. It is different from traditional surgery, where you may end up with a big scar on the tummy, and then in order to perform the procedure, for example, like a hysterectomy, which is removal of the womb, tubes, sometimes with the ovary, traditionally, you have a cut around the bikini line area, big enough to allow the operation to take place. But these days, this operation can be done via surgery, where you have just tiny cuts on the belly button and a few other tiny cuts on the side of the abdomen to perform the same procedure. So you could either perform laparoscopy or surgery, either for diagnostic purposes, and that means looking for the cause of a problem, either pelvic pain or as part of investigation for fertility. But also you could use this as a treatment. I did mention about hysterectomy, where you remove the womb tubes and sometimes the ovary, depending on the condition. But you can also use the same procedure to treat conditions like endometriosis or removal of ovarian cysts. Being able to have laparoscopic surgery is actually quite good for the patient, in the sense that recovery is a lot quicker. You're probably looking at a 2 weeks recovery earlier than what you would have expected with traditional surgery. But also it offers less pain, less hospital stay, and of course, less scarring on the abdomen from where these incisions are made. So for the patients overall, it's all being able to recover quicker and then return to work with less pain, less bleeding. And of course, you have clearer view when you perform the procedure KO. So it all depends on what the procedure is performed for. So if you're just doing a quick diagnostic laparoscopy, and by that I mean looking for the cause of, say, pelvic pain, usually by a week or two, most people are back to work. So recovery in that period is shorter. But if you are doing it for more serious conditions, like let's say you're having it for hysterectomy, recovery could be up to 4 to 6 weeks on the average. So it all depends on the situation for which you are performing the procedure. So as with anything, I mean, there are risks and then there are benefits of performing procedure via surgery. We talked about the benefits already, but also not all conditions are possible to be done via surgery. But if having a procedure done surgery, there's some risks that are quite common. We talk about pain after the procedure, and that's usually felt on the shoulder tip, and this is from the gas that's put inside the tummy when the procedure is being performed. Also, you could have things like a bit of bleeding during the operation, infection, and antibiotics is not given routinely. These are things we look out for. There's also that small risk of scarring or hernia. That's a gaping in the incision made on the tummy. Depending on the kind of operation done, there's that small risk of clots in the leg or lungs. And for that, with a quicker recovery, shorter procedure, then the risk becomes less. But if you're doing a procedure for major operation, then you need to consider other measures to reduce the risk of clots in the leg or lungs. But in terms of serious complications, we said this is in about 1 or 2 women out of 1,000, and you're worried about injury to things around where you operate, particularly the bowel, the bladder, and the major blood vessel. And for things like hysterectomy or removal of a big cyst, then it could affect the ureter, which is a pipe that connects the kidney to the bladder. And in some cases, we can identify those complications and deal with it. But in about 10 to 15% of cases, it may not become obvious until after the woman has gone home. And that's why we say if there's any concern with or any problems develop after any operation, you need to contact your GP or seek medical attention. There are more rarer complications which are serious. It could either be bleeding from the main vessel, or if there's any big complication to the bowel, that will now require conversion from keyhole surgery to open operation to allow better access to deal with the complication. It may well be that you plan to do a procedure, let's say hysterectomy via keyhole surgery, but on getting in, and due to technical difficulty, then you might need to convert to open. So the women need to be aware that, yes, there's a plan to do Operation keyhole, but also they may end up having an open cut to the tummy because of this risk or complications that I've mentioned.